The numbers are official, and they are shaking up retirement planning across America. The Social Security Administration, SSA, has released the Cost of Living Adjustment, COLA, for 2026, confirming a significant 3.2% increase in benefits. This is a massive headline that affects over 70 million Americans, injecting hundreds of dollars back into the pockets of retirees, survivors, and disabled workers. But here's the thing. The headline number is only half the story. The 3.2% is an economic shockwave that forces immediate, complex shifts in everything you rely on. Your Medicare premium, your taxable income, and the earnings limit if you're still working. If you miss the crucial connection between these programs, that 3.2% raise could vanish before it even hits your bank account. We're going to break down the cold math, expose the Medicare trap, and guide you through the $60,000 decision that determines your lifetime income. Before we dive into the details, I want to talk to the most important people watching, our seniors and those planning their future. Tell me in the comments right now, what age are you currently and what state do you call home? I want to know who's out there staying informed because the tax and Medicare rules are slightly different depending on your state and age. The substantial boost, breaking down the 3.2%. The SSA calculates the COLA by comparing inflation data from the third quarter of the current year, July, August, September, against the same period last year. The resulting 3.2% is substantial, reflecting persistent economic pressure on household budgets. Let's translate that percentage into real, spendable dollars. The average retiree. The average Social Security retirement benefit is currently around $1,927 per month. 3.2% boost translates to an extra $61.66 per month, totaling roughly $740 more per year. Maximum earners. If you maximized your contributions and are receiving the top benefit, around $3,800 monthly, you're looking at an extra $121.60 per month, or nearly $1,460 more annually. SSI recipients. The maximum federal SSI payment will also increase by 3.2%. For an individual, the current maximum of $967 monthly will rise to approximately $998. The COLA formula debate, CPIW versus CPIE. While 3.2% is a solid increase, we must address the persistent flaw in the calculation. The problematic metric. The SSA uses the CPIW, Consumer Price Index for urban wage earners and clerical workers. As the name suggests, this index is based on the spending habits of working-age urban employees. It heavily weights costs like transportation and fuel, which might not be the biggest drivers of senior expenses. The retirement reality. Retirees spend far more proportionately on healthcare, prescription drugs, and housing. This is why advocacy groups continue to push for the CPIE, Consumer Price Index for the elderly. The CPIE would result in a higher and more accurate COLA that truly reflects the cost of aging. We are stuck with the CPIW for 2026, but the debate over switching to the CPIE is hotter than ever, proving that the system knows it is currently measuring the wrong kind of inflation for its recipients. The Medicare Part B premium trap. This is the most critical information that will shock you when you see your January statement. The majority of your COLA will be neutralized by rising Medicare premiums. The standard deduction. Medicare. Part B premiums are automatically deducted from your Social Security check. Historically, when COLA increases, Part B premiums increase right alongside it, often at a faster rate than inflation. The math. If your COLA adds $62 to your check, but the standard Part B premium rises by $12 to $15, a likely historical pattern, your net gain shrinks instantly to under $50. The Hold Harmless Shield. The only protection you have is the Hold Harmless provision, which prevents the dollar increase in your Part B premium from exceeding the dollar increase in your COLA. However, This only applies if you are already enrolled in Medicare and your premium is deducted automatically. If you are new to Medicare or pay the premium separately, this shield doesn't apply. The IRMAA and tax bracket creep. For many retirees, the COLA is not eaten by the standard premium, but by two sneaky silent wealth drains, IRMAA and tax bracket creep. First, IRMAA, income-related monthly adjustment amount. This is the surcharge added to Part B and Part D premiums for higher income beneficiaries. It is based on your modified adjusted gross income, MAGI, from 2 years ago, 2024. If you sold assets, converted a retirement account like a Roth conversion, or took a large distribution in 2024, that income spike is now silently setting your 2026 Medicare premium at a much higher surcharged rate, eating up a large portion of your COLA. 2. Bracket creep, the tax trap. This affects millions. Federal tax thresholds for Social Security taxation have not been adjusted for inflation since 1984. Single filers. Benefits start becoming taxable when combined income exceeds $25,000. Married filing. Jointly, benefits start becoming taxable when combined income exceeds $32,000. As your benefit rises by 3.2% every year, you are slowly pushed over these fixed thresholds, making a portion of your benefits taxable when they weren't before. That extra $740 a year from the COLA could be the trigger that pushes you into having 50% or even 85% of your benefits taxed. The earnings limit and the $60,000 decision. The COLA adjustment also changes the Social Security earnings test limits for those who claim benefits before their full retirement age, FRA, but continue to work. The new higher limits for 2026 reflect wage growth, but you must know the rules. Under FRA, for 2026, the lower threshold is expected to increase to around $23,000. You lose $1 in benefits for every $2 earned over this amount. Year. Reaching FRA. The higher threshold is expected to increase to around $61,000. You lose $1 for every $3 earned over this amount, and this only applies to the months before you hit your birthday. The $60,000 question, the most crucial decision in retirement planning, is when to claim. Claiming early, age 62, you lock in a permanently reduced benefit, up to 30% less than your FRA benefit. While every COLA, including the 3.2%, applies to this lower amount, you are applying a percentage to a small base. Claiming later, age 70. You receive the maximum possible benefit plus delayed retirement credits, DRCs, which add 8% per year up to age 70. The 3.2% COLA then applies to this much larger base amount. The lifetime gap? Over a 20-year retirement, the difference between claiming at 62 versus waiting until 70 can easily exceed $60,000 in total lifetime benefits. When you factor in the compounding effect of COLA applied to a larger starting amount, the gap grows exponentially. The 3.2% COLA is a reminder that the biggest retirement move is not about the raise, it's about the base. The state tax surprise? While the federal government is focused on the 3.2% bump, don't let your state government sneak up on you. The hidden tax states. Currently, 12 states still tax Social Security benefits to some degree. Colorado, Connecticut, Kansas, Minnesota, Missouri, Montana, Nebraska, New Mexico, Rhode Island, Utah, Vermont, and West Virginia. The COLA threat. If you live in one of these states, the 3.2% COLA increase could potentially push your combined income over a state-level exemption threshold, triggering a surprise state tax bill next April. For instance, some states are actively phasing out the tax, like Missouri, but the rules change annually. The SSI and SNAP connection. The 3.2% COLA is vital not just for retirees, but for those on the razor's edge of poverty. SSI recipients. The 3.2% bump for SSI recipients is critical. For many, that extra $31 per month for a single person is the difference between affording necessary medication or paying the utility bill. The SNAP impact. The COLA increase will raise the income floor for millions of households. While Social Security income is excluded from SNAP calculations for SSI households in many states, any growth in taxable benefits can affect overall eligibility for other means-tested programs like Medicaid or housing assistance. You must monitor your total income to ensure the COLA increase doesn't inadvertently disqualify you from a more critical program. This 3.2% COLA is an opportunity, but only if you are proactive. You must take action now to ensure you maximize the gain and minimize the loss. Here is your buck breakdown mandate for protecting your retirement stability. 1. Log in and verify. Today, log into your My Social Security account. Verify your earnings record is accurate. An error in your work history means your benefit base is wrong, and the 3.2% COLA is being applied to an incorrect, lower amount. Second, open enrollment is mandatory. The Medicare open enrollment period, October 15th through December 7th, is critical. Use it to shop for Part D, prescription, and Advantage plans. Do not let the premium increase from the COLA go unchallenged by finding a plan that offers better value. Third, calculate the earnings test. If you are under your full retirement age and still working, calculate your 2026 earnings against the new $61,000 to $23,000 limits. Sometimes an extra shift costs you more in withheld benefits than you earn in wages. Fourth, tax projection. Consult a tax professional or use reliable software to run a projection on how the extra income affects your federal and state tax liability. If you are near the unadjusted federal tax thresholds, you may need to adjust your withholding to avoid a surprise tax bill. Fifth, fight lifestyle inflation. The best defense is to treat this COLA as an emergency fund builder. If you can avoid spending the extra $62 per month and bank it, that's $740 per year in emergency savings and peace of mind. Buck breakdown, the final word, the 3.2% COLA, is a much-needed breath of relief, acknowledging that inflation is still hitting fixed incomes hard. But it also serves as a sharp reminder that Social Security is not a passive program. It's an interconnected web of policy, tax law, and timing decisions. The difference between a secure retirement and one filled with financial anxiety often comes down to understanding the invisible factors: Medicare, IRMAA, and the archaic tax thresholds that erode your benefits. You've earned this raise. Now, you need to fight to keep it. Tell me in the comments, do you think Congress should immediately change the COLA formula to the CPIE, which focuses on senior expenses, or is fixing the Medicare premium structure the most urgent priority for retirees right now? If this breakdown helped you navigate the complex world of retirement benefits, hit that like button and subscribe to Buck Breakdown. We'll keep cutting through the noise so you can protect your financial future. Thanks for watching and stay alert.